How to tell if it's roseola or another child illness. Imagine your little one suddenly develops a high fever that spikes quickly and lasts for a few days. This is often the first sign of roseola, a common viral infection in young children. The fever can go above 103 degrees Fahrenheit and might last 3 to 5 days. Interestingly, even with such a high temperature, your child may still be alert and active, sometimes showing mild symptoms like a runny nose, sore throat, or upset stomach. Once the fever drops suddenly, usually within a day, a pink or red rash often appears. This rash starts on the chest or back and then spreads to the neck, face, arms, and legs. It looks like flat spots, sometimes with a slight bump, and isn't itchy. The rash usually lasts a few hours to a couple of days and fades when pressed. Roseola mainly affects babies and toddlers between 6 months and 2 years old. It's quite rare in older children and adults. Some children might also have swollen lymph nodes in the neck or mild respiratory or stomach symptoms. A small percentage, around 10 to 15%, may experience febrile seizures because of the rapid temperature rise. Now, how can you tell if it's roseola or another illness? For example, measles usually starts with a rash on the face and head that spreads downward, while roseola's rash begins on the trunk after the fever ends. Many viral illnesses cause fever and rash, but the key difference is the sequence. In roseola, the fever comes first and ends before the rash appears. In other illnesses, the rash and fever might happen at the same time, or the rash might come before the fever. The pattern and timing are important clues. Usually, a sudden high fever lasting a few days followed by a quick rash is typical of roseola. Doctors often diagnose it based on this pattern and the child's age. Blood tests are rarely needed but can confirm the diagnosis if necessary. If your child has a high fever that lasts a few days and then develops a rash as described, roseola is a likely cause. But because other serious illnesses can look similar, it is very important to see a healthcare professional for an accurate diagnosis. Treatment for roseola is mainly supportive, meaning you focus on managing the fever with appropriate medications and keeping your child hydrated. There is no specific antiviral treatment for healthy children with roseola. In summary, watch for a sudden high fever in a young child that lasts several days, followed by a distinctive rash that appears as the fever breaks. This pattern is a helpful way to tell roseola apart from other childhood illnesses. Always consult a healthcare provider to confirm the diagnosis and ensure your child's health and safety.